Then comes the palatal approach superior anesthesia, which anesthetizes 6 anterior teeth, palatal soft tissue, and labial soft tissue. Then come the inferior alveolar nerve block. Inferior alveolar nerve block is given for post-operative pain control. Post-operative pain control following cleft repair. Inferior alveolar nerve block is given to control the post-operative pain following the cleft repair. Then come the intraligamentary anesthesia. Intraligamentary anesthesia. What is intraligamentary anesthesia? An intraosseous anesthesia in which the ala goes first into cancellous bone or cancellous space, then in bone with the help of PDL, via PDL. So intraligamentary anesthesia, which is an intraosseous anesthesia in which the local anesthesia go in first cancellous space, then in bone via PDL. 0.2 ml solution is injected. 0.2 ml of solution is injected. Then comes the single tooth anesthesia. Single tooth anesthesia. Single tooth anesthesia is given by PDL technique, and it provide high volume under low pressure, providing high volume under low pressure, and 1.8 milliliter of lidocaine is injected, but 0.45 milliliter to 0.9 ml is for children. It decreases the chances of collateral soft tissue anesthesia. So these were all the techniques. Now we will discuss the complications. Complication of local anesthesia can be generalized and localized. So the generalized can be syncope, means fainting which occur due to anxiety, allergy to local anesthesia or any agent that is present in the composition of anesthesia. For allergy, you have to first go for patch test. Toxicity if given in overdose, cardiovascular effect, CNS effect, methemoglobinemia. What is methemoglobinemia? In methemoglobinemia, the ferrous iron which is present in normal hemoglobin, ferrous iron, is converted into ferric. What happen if ferric is present in blood? It will not consume oxygen. It will not combine with oxygen. It will not combine with oxygen. So prolocane and benzocaine cause methemoglobinemia. Syncope, allergy, toxicity, cardiovascular effect, CNS effect, methemoglobinemia, ferrous iron converting into ferric, and infection and use of disposable needle. Why we are using disposable needle? We are using disposable needles to prevent needleistic injury. So the generalized complication are syncope, allergy, toxicity, cardiovascular effects, CNS effects, methemoglobinemia, ferric which do not combine with oxygen, infection, and uses of disposable needle. Then comes the local. In local, first are late and then early. In early you have pain. Why the pain occurs? Pain occurs due to needle penetration. Either the injection is penetrating too rapidly or injection is inappropriate. We are penetrating the injection inappropriately. Then comes the intravascular injection. You have injected in artery or vein or capillary. This happened because you haven't aspirated earlier. You forget to aspirate and you have placed intravascular injection. This will cause local pain and systematic effects. Systematic effects? Tachycardia and palpitations. Then comes failure of ALE. Why local anesthesia fail? It fails either of the anatomy, either of accessory nerves, and either of molar enamel hypomineralization. These are the three reasons which cause the failure of local anesthesia. Anatomy, because sometimes the zygomatic buttress is present lower, which will not result in diffusion of local anesthesia. So what we have to do, we have to inject the anesthetic agent mesially and distally to upper first molar zygomatic buttress region. What happened in accessory nerves? In accessory nerves, due to accessory innervation is present due to pulpal supply from the greater palatine nerves. So what we have to do, we have to block supplemental palatal anesthesia, or we can give single tooth anesthesia or AMSA. These are given for accessory innervation which comes from greater palatine nerve. And what we will give STA, single tooth anesthesia, AMSA, or supplemental palatal anesthesia. Pain, intravascular injection, failure of local anesthesia, and motor nerve paralysis. Interference with spatial senses, and hematoma formation. These are the earlier complications. What were they? They were failure of local anesthesia, hematoma formation, pain, intravascular injection, interference with the spatial senses, and motor nerve paralysis. Now come the late complications. What are the late complications? They are self-inflicted trauma, because your lip or tongue is already anesthetized and you cannot differentiate, and you have bite yourself, and after the effect of local anesthesia end, you realize that there is trauma to your lip or tongue. Self-inflicted trauma, oral ulceration, long-lasting anesthesia, trismus, infection, and developmental defects. These are the late complication of local anesthesia: self-inflicted trauma, oral ulceration, long-lasting anesthesia, trismus, infection, and developmental defects. This was all about local anesthesia. Thanks for watching.